Good afternoon, everybody. Welcome to everybody to the Community Sector Wellness webinar. This webinar is to inform upon and celebrate the critical role communities play on improving wellness in our province. My name is Colin Corcoran, CEO of your Community Sector Council. And on behalf of our board and our team today, we'd like to thank you for taking the time to join us. Speaking of today, I will talk about the format for today's webinar before we get into it. So first of all, we'll talk about the community sector and how it relates to wellness. Then we'll introduce our guests, Dr. Fitzgerald and Dr. Parfrey. And then there'll be an open Q&A. Webinar participants who are joining us via Zoom, please put your Q&A into the Q&A box that you'll see on your screen. And those joining us on Facebook Live, feel free to add a comment that we'll be moderating. Teammates here at CSCNL will be moderating chat for questions. Then I'll collect those questions and ask them of our guests. We'll go along until about 3:25 and then welcome some closing remarks. So before we get into that, let's talk about our sector. We know that in Newfoundland and Labrador, there are 3,480 registered nonprofits and charities in our province. And that doesn't include an estimated 3,000 informal organizations spread right across our province. These include religious organizations, recreation support, community and economic development, service clubs, employment centers, heritage, youth, arts, environment, business, seniors, food banks, emergency services, and the list goes on. It covers almost every facet of society. Supporting this sector is an estimated 16,000 paid employees. In a provincial context, our labor force of our sector is the 5th largest in the province. This also doesn't include the number of volunteers, with a staggering 45% of our province above the age of 15 reporting to be engaged in both formal and informal volunteering. That's over 200,000 people in our fair province. According to Statistics Canada, nonprofits, excluding government entities, contribute $567 million to provincial GDP. We are a significant social and economic sector. We also play a significant role in the future wellness of our province, and we exist in every domain of the social determinants of health. We see it every day. We see it at the card tables organized by the 50+ clubs to help with socialization and create a sense of well-being and belonging for our seniors. We see it in the dirt and community vegetable gardens, helping to supplement diets with healthy food to combat food insecurity. We see it in the volunteers actively combing our beaches and roadways to make our environment a better place, and in turn, making our existence in the environment so much of a better experience. We see it in trail associations carefully planning out the next trail extension to give people a balanced, ecologically sound way to hike and exercise. We see it as an employment officer help someone update a resume and finally get attached to the labor force. We see it on posters and in posts of advocacy groups marching for equality. We see it on the faces of our children, laughing and playing, learning and growing through so many children's camps and programs, contributing to positive early years of development. We see it on the soot on a volunteer firefighter's face, and the gratitude on the faces of others, knowing they are safe in their own homes. We see wellness happening in our sector every single day. And we can see ourselves in supporting, catalyzing, and advancing what is needed to create a strong, healthy, and connected province. And now, over to two people who are actively working to create a better tomorrow. Today, we have joining us Drs. Janice Fitzgerald and Parfrey. Janice Fitzgerald, someone who almost needs no introduction at this point, is our Chief Medical Officer of Health for the province of Newfoundland and Labrador. She champions community well-being. Her expertise in public health and social determinants of health drives her commitment to our province. Born in Trinity, she graduated from Memorial University of Newfoundland and Labrador with a Bachelor of Science, Medical, and Master's degree in Public Health. Dr. Fitzgerald's career spans family and emergency medicine. She transitioned to public health in 2017 and has been a critical voice during the COVID-19 pandemic. We used to tune into her all the time. She has earned accolades such as the YWCA St. John's Honorary Woman of Distinction Award in 2020 and the Order of Newfoundland and Labrador in 2022. Joining us as well is Dr. Pat Parfrey, co-chair of the Health Accord Newfoundland and Labrador and Deputy Minister of Health Transformation. Pat helps shape healthcare in Newfoundland and Labrador. Beyond healthcare, I'm told he's also a rugby legend. Graduating from the University College of Cork, he joined Memorial University. His roles included Associate Professor of Medicine and Chief of a Division. Dr. Parfrey's research spans genetics and healthcare delivery. Awards include the Canada Institute of Health Research Distinguished Scientist Award and the Order of Canada. Next month, he'll also receive, and congratulations, the Order of Newfoundland and Labrador for his remarkable contributions to both healthcare and rugby. Also joining us today is another special guest, Lynn Taylor. Lynn is the Special Advisor of Health Transformation. Lynn comes to the province from Memorial University, where she worked at the Quality of Care NL. She spent over a decade supporting and managing hospitality in Newfoundland and Labrador, and certainly understands our sector. Lynn holds an MBA and a Bachelor of Kinesiology from Memorial. Welcome to you all today, and over to you, Lynn.
Hi, Colin. Thanks so much, everybody. We're pleased to have you folks here today to help us kick off Wellbeing Week. As you may have seen in the news, we are starting our Wellbeing Week yesterday, and we kicked it off with a great event at the Rooms. And we're pleased to talk to you today about what well-being means and how we hope to continue this long beyond Wellbeing Week. So I will pass this over to Pat. I'll do a share screen, Colin, and away we go.
Sounds good.
Pass it over to Janice. You can get started, Janice.
Okay, thanks. Can everybody hear me okay?
All good.
Right. Good. So thanks everyone for meeting with us today. This is pretty exciting stuff to be talking about a provincial approach to well-being. I've been in public health for maybe 6-7 years now, and certainly in health and in the health system a long time before that. And I think this is the first time I've seen this talked about so broadly and with such conviction and dedication. So I'm really happy to be here to talk about it. And so we're really talking about the province's approach to well-being, starting today to improve tomorrow. So we know that there's a lot to our well-being that's more than just our healthcare system, and that it starts long before that. And so that's what we want to really focus on today. Next slide, Lynn. So it's kind of, I sort of started, I guess, as we receive, all ministers receive mandates from the Premier at the start of their terms. And in 2021, the Minister of Health and Community Services at the time was asked to work towards making our province one of the healthiest in Canada by 2031. And really, as everyone has alluded to at this point, this really can't happen without prioritizing those social determinants of health. And social determinants of health are those things that are the aspects of healthcare that really aren't healthcare. It's your housing, it's income, it's experiences of racism or environment that you live in. These are all things that can influence your health in the long term, and there are others as well. And so that's what we really need to focus on if we really want to make some meaningful, long-lasting change really to health, and to instead of sort of focusing all of our energies at the other end. So next slide then. So social determinants of health have a much greater impact on our health than the healthcare system. And 60% really of what we would call our social determinants, which are things that happen in your life and in your environment, are really can influence what your overall health will be and how you experience well-being. And so some of those include income, early childhood development, education, exclusion, so social exclusion, as well as housing, feeling of belonging, community, employment, and working conditions, as well as your environment. So the infrastructure, the built environment that you live in, and the quality of your housing. Next slide. And if we really look at this, we can see that we have done a lot. We've spent a lot of money over the last 30, 40 years or so on healthcare. So the healthcare system, and we've increased that spending by well over 200%. Spending, though, in social areas has really only increased by about 6% in that same period of time. So if we really want to make an impact in those social determinants of health, we certainly need to look more towards increasing the spending in that area, and to really affect some of those early changes. And we need to think about, like, for every bit that you spend in those areas, you see the things that you see are much bigger in the long term. It's almost like, if you veer off the path by 1 degree, well, in the beginning, 1 degree doesn't seem like very much, but at the end of your flight, 1 degree off path, it can be an awful lot. So we can certainly, by putting just a little bit in at the start, in the beginning, in what we call the upstream areas, we can see big changes in the end. So that's our aim here, is to increase the spending there so that we do see those big changes in the end. Next slide, Lynn. So certainly one of the things, and perhaps one of the biggest social determinants of health, is income. And we know that people who experience poverty, live below the poverty line or around the poverty line, are at risk for falling below the poverty line, certainly have more ill health experiences. So poverty in and of itself is actually very expensive, and we are spending on the consequences of that. If we think about childhood poverty, I think it's fair that most of us would believe that child poverty really is unjust. There is no place in this day and age where children should be not having enough money to be able to, the families have enough money to meet the needs for daily life. And we know that, when we talk about adverse childhood experiences and the impact that can have on health outcomes, and we know that there is definitely a connection, poverty is actually one of those adverse childhood experiences. So it really, as a society, this is something that we need to look at, reducing and eliminating childhood poverty, obviously. Next slide. So why do we need to tackle the social determinants of health? And I think, we all, I don't know, perhaps a lot of you have seen this slide before. It's certainly, or iterations of it. Certainly we all talk about equality and everybody having the same, but not everybody needs the same thing to be able to surmount a barrier. And so sometimes people need more. So equity is about people getting what they need to be able to overcome barriers and to access, whatever that may be, whether it's healthcare or it's other parts of society, other services that are available in their communities. And then if we think about justice or social justice, really what that means is that we remove those barriers entirely. But it also, I think, includes inclusion, and that people are able to feel supported in their environments. They're able to grow and thrive and interact in their environments. you know, be able to live the best possible life that they can. Next slide. So the things we want to talk about when we talk about social determinants, certainly things that the health court has brought forward, really looking at how we live and a life with economic security. So looking at basic income, food and housing security, and income support, and looking at where we live and addressing the climate emergency. So how do we improve awareness, reduce our footprint, and think about the health impact of climate action, and also to look at you know, our built environment and ensuring that that is attributing to well-being as well. And then also how we relate to one another so that we have an inclusive society. And so some of that is, you know, meeting people where they are and recognizing that people who experience exclusion, individuals who may you know, be a part of communities or populations that are equity deserving, they are the experts in their experience and in their context. And so we need to meet people where they are and to engage meaningfully to ensure that we are getting the expertise of those populations and those individuals. And then, of course, investing in our future, looking at early childhood and youth. So making sure that children have healthy environments. You know, those first few years of life are so very important for development, and ensuring that families are supported to be able to provide the best possible environments for children to grow and thrive. So really trying to ensure that we are creating as safe, inclusive, and supportive environments as possible. Next slide. So we do have a lot to celebrate in this province. You know, we certainly have a strong sense of community and connection, and in surveys that have been done, national surveys, certainly our province seems to do quite well in this regard. So, you know, that is something to celebrate, and that is something to draw on. There's also strong confidence in our public institutions, and our metrics on safety and security are good in comparison to other provinces. But that doesn't mean that it applies to everyone, and we certainly know that, again, those equity deserving populations may not feel that same level of connection. And so again, it's about really meaningful engagement and inclusion to ensure that we have all of those voices at the table and informing our work. Next slide. So we're focused on building awareness and action to influence social factors on health outcomes and quality of life. So why does well-being matter? What is well-being really? It's an overall positive quality of life where needs are met across many aspects, and that's physical, mental, social, economic, environmental aspects of life. And so it's really about those social determinants of health. And if we think about well-being and health, it's really about being able to deal with what comes at you in life, right? It's about being able to be resilient. It's about having the resources necessary to be able to confront any challenge that may come our way. And when we are able to do that, that is when we experience well-being. If we think on ourselves about the times when we feel like perhaps our well-being wasn't as good as it should be, sometimes it is because, you know, some challenges feel overwhelming and we feel like we may not have those resources to be able to do that. And health is really just one of those resources. Health in and of itself is not an end state. Health is a resource that allows us to be able to move through life in the most productive way possible. And that when we have good health, we're able to be able to do things that we need to do. We're able to respond to things. And it's not just an absence of disease that we talk about. It's really about us having those resources that we need to be able to deal with the challenges that come. Next slide. With that, we have a little video that we'd like to play for you that is part of our well-being week. And so Lynn, if you can get that going.
Newfoundland and Labrador is focusing on well-being to become a healthier province. But what is well-being, and why does it matter? Well-being is defined as an overall positive quality of life where a person's needs are met in many important areas. Where and how we live and work, and what supports we have access to, referred to as the social determinants of health, have a strong influence on our health and well-being. We experience far better health outcomes when we have access to safe housing, good food, and clean water, access to quality education from a young age, inclusive and stigma-free social connection, access to a justice system that protects us, access to good medical care and mental health supports, access to income that protects us from poverty. These are just some aspects that affect our health and well-being.
So over to me. So there's quite a lot of work being undertaken on policy within government that needs to be implemented. And you can see here, there's a list of plans that are in progress or being made into policy. And what's of course required is coordination, alignment, and integration of these plans. And they include a social well-being plan, child health model, healthy active living plan towards recovery. We've heard about water quality action, housing and homelessness action plan, education action plan, tourism, health and all policies, truth and reconciliation commitments, and others. So it's not as if we don't have plans, but our challenge will be to implement them so they have the effects that we want to see. And the next slide. We've done a lot of analysis of data that's available comparing provinces about multiple metrics across 5 domains. They include prosperity, social, health, environment, and governance. And this slide just summarizes what we think the metrics mean when we look across the country and compare ourselves to other provinces. And what's clear down on the bottom left-hand corner is something that's really important, which is that our overall quality of life is probably the best in the country. There are strong feelings of good well-being. There are high levels of social cohesion, safe and secure communities, confidence in institutions. So we need to celebrate that fact and accept that fact. Probably that to implement change in healthy living, we should use this underpinning as the basis for how we go forward. And the concern we have is that our life expectancy is less than other provinces. We've got high rates of cancer, stroke, and cardiac disease. And these are predisposed to by the top right-hand corner, childhood poverty, educational deficits in that skills and development in youth are low compared to other provinces. There are high disease risk because of risk factors that include decreased fruit and vegetables, smoking, alcohol, obesity, and activity. And of course, we've been told that multiple equity-seeking groups feel they're excluded in this province, including the Indigenous people, LGBTQ and community, and people with disabilities. And when you examine the data of those people compared to those who don't have those criteria, they are absolutely and disgracefully affected in their health. So we feel that there are certain things that can be undertaken that will actually lead to better health, targeted interventions in social terms of health, particularly a target on childhood poverty, investments in skills and development along with early childhood development, health promotion in two ways, one through schools, workplaces, and communities in terms of living more healthily, and then disease prevention of individuals within family teams. And then, of course, all this needs to be looked at with an inclusion lens to ensure that these equity-seeking groups are treated, are included. So the next slide. We're using the term well-being to follow leading jurisdictions across the world, which and it includes these concepts of social determinants of health, health in all policies, and population health. And health in all policies is that which every policy put into effect by a government takes into account the health implications. The social determinants of health are those social factors that influence our health that Janice spoke about. Population health is the approach to groups of people within our population in an attempt to improve their health outcomes. And we're encapsulating those various concepts under the term well-being. And on the next slide, you can see that there are several national jurisdictions that have taken leading positions on well-being. Finland, economy of well-being, places this at the heart of policy and decision making. In New Zealand, there's a well-being budget. In Wales, there's been 7 well-being goals put in place to improve the social, economic, environmental, and cultural well-being of that country, and they're enshrined in law. And in South Australia, there's a government agency that focuses on primary and secondary prevention to lead system change and better support community health and well-being. So we're not the first to the table. And even in Canada, we have got, on the next slide, Lynn, we have various things happening in multiple different provinces. First of all, I've mentioned the domains of the federal government's quality of life framework. Several provinces have taken major steps to focus on social determinants of health and well-being as part of public policy, particularly reduction of poverty, improved housing, supporting childhood development, reducing inequality through dedicated initiatives and programs. Several provinces have embraced a health in all policies approach. And several provinces have taken steps to incorporate well-being into their budgeting processes, policy frameworks, recognizing well-being economics indicators. So we would hope that we could become a well-being province. Next slide. So what about Well-Being Week? I think that people must understand that our primary aim here is to raise awareness around the social determinants of health and an upstream approach towards changing our health outcomes. So we're focusing on well-being to become a healthier province. And this week is our kind of a start to learn more, engage, support, take action around the many factors that impact our health and quality of life. It's a week to build momentum and empower people to continue making meaningful steps to better our well-being today, particularly tomorrow and beyond. So we all play a role in improving health. Well-Being Week is then an opportunity for individuals, families, communities, groups, businesses, organizations, and governments to kick off this long-term goal. And you can see from that statement that we're saying that this is it's society's role and responsibility, not just the government of Newfoundland and Labrador. The next slide. So, as I said, our objective is straightforward. We want to increase awareness of the social factors that influence health. And we feel that that awareness needs to come as policy is being developed, then that those policy plans are announced to the public, and then they're funded within the provincial budget and implemented. And our messages, I think, are that well-being is more than physical health. It is mental, social, financial, and environmental well-being. It's more than healthcare. It's the social sector. It's the education system. It's justice and other things. And well-being must involve all of society. So for this week, we're taking two approaches. We're having events for the public in association with the public that are trying to demonstrate the holistic approach to well-being. And then there are government announcements that will inform the public of policy directions that it's taking. And of course, we do know that there'll be further policy announcements and more major policy announcements made over the next number of months. Then you've got the budget of 2024, where you hope that these social issues are addressed. The next slide. So if you go to Wellbeing NL, you can see the calendar of events for the public each day. And we had started yesterday, and a videotape of the farmers market and the instant choir and the cold plate supper of Large Avalon. And today there's been several more things take place. There's been an interview on Paddy Daly's on the OCM and 4 more planned. There's been a communication with the staff of the NL health system. There's been a public announcement about a tool that would allow activity to be undertaken by anybody in this province, supervised by a healthcare provider or not. And now we've got this event where we're talking to you. You've got people who've got big roles to play in well-being. And there are more things planned for the next number of days, and more public announcements by government. So the next slide. That's the last slide. So I pass back now to Colin so that he can moderate a question and answer session, and we'll answer whatever you want.
Thank you, Pat, and thank you, Janice, for that informative presentation. So for everyone joining us again on the webinar and on Facebook Live, for the webinar, there's a Q&A box at the bottom of the screen. Please feel free to pose your questions, and then I'll read them out for either Dr. Fitzgerald or Dr. Parfrey, depending on who answers or who would like to answer. And in addition, we have some questions that came into us during the registration period and potentially on Facebook Live. So to kick us off, I go to a question from Kelly Strang. Kelly is a Choices for Youth housing support mentor and a former go-getter of one of CSCNL's programs. And so Kelly asks, given the challenges that come from the current cost of living, in what ways can we play a part in improving on their sense of well-being, particularly those who are affected by the cost of living in the province?
Will I start, Janice? So I mean, there are a number of social issues that are front and center at the present moment that require to be addressed, and clearly in some of these areas that is the function of the current government to work out how they feel they should be addressed, and how they're going to fund those interventions, and how they're going to plan those interventions. So I suppose what we're saying is that people might like this comment, but the reality is that government takes time to work. There is this. We're talking about awareness. There are certain things that everybody is already aware of, including the one that you mentioned, that the cost of living has gone up. But the development of policy and the identification of the money and the announcement in the budget for the interventions that are necessary to take place takes some degree of time, and that applies to the other areas that are front and center, particularly. I have to answer that call, Colin. Sorry. And you can take another one, which is the drug overdoses, where this is front and center now, and we do want to get actions to be undertaken as fast as possible. But I will
Fantastic.
defend the need for awareness of the social determinants of health, and that this type of week is really necessary to try and get the public engaged in understanding what it means, and understanding that support needs to be provided for interventions that improve the social determinants of health, and to understand it's not all about healthcare, and that the political will is going to be driven by the public and how much they believe that action needs to be taken in these particular areas.
Fantastic. Thank you, Pat. Dr. Fitzgerald, would you like to answer?
Sorry. Can you repeat the question again?
Given-
Like a goldfish here today.
No worries. Given the challenges that come with the current cost of living, in what ways can we play a part in improving on their sense of well-being?
Yeah, I mean, that's difficult. I guess it depends on in what way that you're connected, you know. I think advocacy is very important, and I think for those groups that would consider themselves advocates as well as providing perhaps services at times, that's really important as well, to ensure that voices are heard. And then also, as I said, you know, it's really important for us to engage with people who truly understand what it is to live, you know, affected by negatively by some of these social determinants of health, and who may feel excluded. And so ensuring that those voices get brought to the table, or helping to get those voices to the table, is really important. So I do see a strong role for advocacy there, you know, recognizing that not all groups have that role, but for those that do.
Fantastic. Thank you. I know during the presentation, we talk about adding that inclusion lens, that equity lens to everything that we do. Question from Abdul Latif, who is a Grenfell campus student and advocate. His question will be around, what are we doing to ensure the well-being of newcomers and international students in the province? So how do we see newcomers, new Canadians, immigrants, and international students? How do we see them in terms of well-being?
I think from the beginning, they are a disadvantaged group. They have certain things that can be done better to integrate them and to allow them to study and to allow them to get jobs. And again, this is an area where you're hoping that policy keeps up with the need, and that again, advocacy is necessary to identify the areas that need to be done. But there's little doubt that immigrants are disadvantaged from when you measure the metrics of quality of life.
Yeah, we certainly see that newcomers need to have, you know, that there is certainly, I think, vulnerabilities that may need to be addressed. Not all newcomers are in that situation, but many are, especially given some of the situations where people are coming from these days. And so I think it is really important, as Pat said, for us to ensure that we are keeping that front and center when we're talking to these to any groups that are working with newcomers. And I know in the Department of Health, certainly there's a lot of work that's being done to ensure that health needs are being met in public health specifically, and but in other areas of health as well. And but you know, housing is another place where that work has to be done. And so we certainly do need to ensure that we are keeping abreast of all of the urgencies that are associated there, for sure.
Fantastic, thank you. And during the presentation, we mentioned about the calendar events, and I did go on to Wellness and our website not too long ago, and had to keep scrolling with all the events that are happening this week. So it's great to see. This question comes from Robin Regular out of Botwood. And so Robin asks, is there and specifically when it comes to the calendar well-being events for the area, how can a community receive funding to provide well-being activities and events? And another question related to is how can communities and community groups and organizations contribute to some of the events and celebrations that are happening during Wellness Week and beyond?
So I think that we're trying to demonstrate the holistic nature of well-being and how that is more than physical well-being, that it's mental and social and financial and environmental. And we've done this is our first time doing this because we want to do the week as an awareness event or an awareness week. And we said at the beginning that when you do it the first time, you're going to have deficiencies and you won't get everybody and people won't hear about it, like this person here, or might not hear about it. And that, but we need to start. And that next year we'll do better, we'll have more people involved and we'll have better events and we'll have better focus and we'll have matching it with actions, it will be better as well. So we have accepted that weakness and we felt it was important to go ahead. And on top of that, we accept the weakness that's associated with the fact that we're not announcing policy to deal with the current social issues that are in front of us, and would expect to have a lot of pushback because we can't do that. But even though we expect the pushback, we felt that what we were trying to achieve was really important. And it's not to achieve it with the people who are working in the sector because they know what's going on. It's to connect with the general public so that the general public understand the importance of the various and understands the holistic nature of what we're talking about, and that it influences the decision makers and the politicians to make choices that favor intervention in the social determinants of health.
Thank you for that, Pat. And as we're listening, as we're discussing, certain terminology comes up in terms of upstream approaches, in terms of health and all policies. Could you probably speak a little bit to what an upstream approach would look like or what a health and all policy would look like, and probably provide an example of what that might look like in practice?
Yeah, so certainly when we talk about upstream effects, what we're talking about are interventions that happen long before. We generally talk about upstream in terms of health outcomes, and so you know, if we were talking about a certain health outcome, then we would want to make an intervention far upstream or well before that outcome will occur. So getting back to, again, early childhood and setting. So if you're thinking about trying to improve exercise levels in an adult or someone who's an adult, well, an upstream approach would be to create environments where being physically active is a normal way of being and is encouraged and is an easier choice, and that barriers that can prevent people from being physically active are removed. And so they develop this habit really of being physically active, and that hopefully then can continue throughout their lifetime, and they will see the importance and experience the benefits of being physically active. You know, that doesn't always mean that people have to be involved in sports. It just means that people have to be able to get out and be physically active, whether that's playing when they're children or you know, being physically active in other ways like hiking or whatever the case may be. So so those are just, you know, creating those environments in the early years that encourage healthy, positive behaviors throughout life. So that's one thing. Ensuring that you know, you have families that have good income, so that they don't slip into poverty, and that they, you know, then food security is there, so they're able to eat healthy foods, and that people develop you know, a taste for healthy foods that lasts them throughout their lifetime, and they understand the importance of it. So those are, so focusing on the upstream, so really focusing on things way back to the causes of the causes, so to speak, of those poorer health outcomes, really focusing on those to improve health outcomes. When we talk about health and all policies, what we're talking about there is really, it's an approach that we use in health promotion, where we try to have all areas within government, or it doesn't have to be just within provincial government or federal government, municipal governments as well, but also it can happen in workplaces. It can really be applied anywhere. In our situation right now, we're talking about it in terms of government agencies and departments. And really what we're talking about is that we look at, when we're developing policies, when we're developing legislation, we are really thinking about how can this improve or certainly have a neutral effect on health, so that we're not bringing in policies that are going to be detrimental to health in any way. So we're really thinking about, ultimately, my goal would be that every policy that comes in, first and foremost, we're bringing that in to say, well, how is this going to improve the health and well-being of the population, first and foremost? And if that's not the case, if we can't prove that, then we need to think about the policy and why are we doing it. Understanding that health and well-being is about so much more than just health, right? It's about all of those things that we've talked about before. So that's really what health and health policies is about. And it's not as, it seems intuitive that we would do that, but it's not as easy as it sounds, because it's sometimes is very difficult to be able to think about all of those unintended consequences of our policies that we bring in. So we are, there are processes that are being developed that can aid in that, and certainly it's a very new and exciting thing that we're doing within the Department of Health and Community Services here. We're actually, it is enshrined in our public health legislation that the minister is responsible for in facilitating health and health policies. And we are only the second jurisdiction in the country to actually have health and health policies as a formal policy, a formal approach to health. So we're very proud of that.
So I might just I want to add to the comment about health and health policies, but the challenges that exist with trying to implement change. And we had a webinar with municipalities, and the mayor of Harbour Breton spoke about the fact that we got trails and we got treks and we got this and we got that, gyms, etc., but people aren't using them. And the policy there, and the health policy that's necessary as well, can we find out why, and then can we intervene to ensure that we're able to remove the barriers so that the capacity to exercise and live a healthier life exists? So the policies probably, it's a kind of a tangential thought, but the policies need to change to be able to fit what's happening within a particular community, and they're probably different for different communities.
Thank you for that additional insight, Pat. And as you're both speaking, I can't help but be reminded of the intersectionality of a lot of these policies and a lot of the initiatives that we could potentially do to alleviate a number of issues that we're faced as a society. Some of the questions that are coming up are centered around poverty and income. And so Marion Party of the Religious Social Action Coalition writes in and asks, given that poverty is a large social determinant of health, and presently we are focusing on consequences versus causes, can you share an update on the All-Party Committee on Basic Income, or when a report might be presented? And in particular, how does well-being and a basic income intersect with one another, particularly in the context of a health and all policy framework?
Well, I'll answer that in terms of that there was little doubt that from the health accord, we felt that there needed to be a focused effort to intervene in childhood poverty. And I continue to feel that childhood poverty is the one area where the benefit of an intervention is proven and is so much greater than any other intervention. That support for interventions in childhood poverty would be something that I'm personally, and not my post, I can't say what I do my post, but my personal opinion. I think that the issue about the all-party committee, I'm not sure when they're reporting. They certainly have met and have had various types of consultations with various groups already. But the the issue of a guaranteed basic income, which can be supported in a lot of different ways, is probably not some way that this province can go by itself, and it needs to have federal interactions there to be able to determine if that's feasible or not. But I do think that the poverty is one major thing that requires us to spend money on, and is going to be, I suppose, controversial at one level, one political level, I mean. So.
Fantastic. Thank you, Pat. Dr. Fitzgerald, do you have any thoughts?
I mean, certainly working in public health, when you talk about intersectionality, I can certainly say that everything is intersectional. You know, we've not found anything yet that's just itself and not related to anything else. And a girl can dream, I suppose, but I don't think I'll find it. Yeah, so there's certainly a you know, there's no doubt that experiences of poverty can certainly have an adverse effect on development of children, and not just with regard to the food that's available, but poverty itself and the stressors that come with worry and concern about income. That certainly can contribute to poorer health outcomes. It can contribute to other outcomes, you know, educational outcomes, longer term vocational outcomes. So we certainly understand there's nobody right now working in public health or in the Department of Health who doesn't appreciate the and I would say a lot of government departments actually, who doesn't appreciate the you know, the impact of having a decent living basic income is, you know, the impact that can have on a person's life. So yeah, it is, I think, one of the major things that we have to focus on. If we're really, income is perhaps the biggest determinant of health when it comes down to it.
I think that our discussion clearly demonstrates that the need for awareness and the importance of the social determinants of health in our society exists.
That's an excellent point, Pat. And so we have time for just about one more question. I'm going to combine a couple into one here. Earlier on in the presentation, we saw a slide that spoke to the percentage increase in healthcare spending and a percentage increase in social spending since 1981. Can you talk a little bit about the relationship of these two spending areas? And if an increase in social spending could have an adverse decrease in health spending, or what the relationship between these two spending categories are?
Well, I think that it's driven by the public wish to get more healthcare, and the awareness that the spending on social factors was likely to have a big effect on the downstream effects and consequently on the use of healthcare. So the way we have evolved is not consistent with the way we see adverse health outcomes developing. And we are now far higher per capita than Canada is in terms of our healthcare spending, and we are lower per capita for social spending. Canada went up by 100% in that 38 years, and for healthcare spending, by 36% for social spending. So I would argue that needs to change. Withdrawing spending from healthcare is difficult, you know, because the public believe that those dollars are well spent, and I'm one of those who believes it's not. I believe that a lot of the medical spending is wasted on drugs and visits and interventions that provide no real benefit, that getting control of how we spend that money is really important, and that there needs to be an effort to enhance the quality of what we do in the healthcare system. And in doing that, then you've got more money that can go into the social system.
Yeah, and I think we won't, you won't, an investment in the social system is going to have to be an investment in the social system, right? It's not going to be able to be at the expense of the health system. And for a while, we'll see both go up. And then eventually, hopefully we'll see the health system spending come down proportionately. And I think, we have to be realistic about what to expect here, because these interventions are going to take, in some cases, years to really show their full benefit of the intervention. It doesn't mean that we shouldn't do them. This isn't as much about justice and social justice and equity as it is about better health outcomes. And in fact, I would argue that it's more so about that. It's that we live in a society that thinks that everybody should have the best chance. Every child that's born should have the best chance that they can to be able to live to their full potential, and to live the life that they want to live, being able to be resilient and be able to keep a roof over their head and food on their table. I don't think that's that many of us would argue that that's not the case. So we need to realize that we may not see the benefit of those investments right away, and perhaps that's part of the reason why it's happened the way it has, because it's easier to see the benefits in healthcare, right? You invest money in reducing wait times, and in a short period of time you have wait times reduced, and that may not be the case, but that doesn't mean we shouldn't do it, and we need to be prepared that it may not look perfect right away, and it may not look successful right away, but that doesn't mean that it won't be.
That's a critically important point, particularly as the importance of these types of sessions is to inform, is to alleviate any misunderstanding about the purpose of well-being, and the fact that the impacts that we see from positive interventions are not going to happen tomorrow necessarily. They're not going to happen next week or next year. Hence why this is a 10-year horizon, why we look at these data sets and this information over a long period of time. And so from what I take away from the answer to that question is we're really investing in our future here, and we're really taking a concerted effort around what that looks like, and testing and modeling along the way based on the good work from other jurisdictions, both nationally and internationally. We're coming up to the end of the webinar. I'm cognizant of both your time here today and everybody's time. Is there quickly any parting remarks that you would like to tell the community sector and the participants today? Or is there any points you'd like to make that didn't come up during the conversation?
I'm going to have to go, so I'll leave Janice make the remarks. Bye.
Thank you very much, Pat.
He's always going somewhere. No, I just thank you to everybody for coming, and hopefully I suspect there's probably a lot of people on the line who knew a lot of this stuff already and live it and preach it every day. And hopefully we added something to the conversation and to the knowledge level. And I think you're right, it is an investment in our future, Colin, and what else is there to invest in if it's not that? So
I think just as quickly investing in our children to invest in their future, pulling one of the other themes from the conversation. Dr. Fitzgerald, thank you. Thank you for joining us today. Lynn on the back end, thank you for joining us. And all the participants on the webinar on Facebook Live. Just want to thank you again for joining us today and continuing this conversation about wellness in Newfoundland and Labrador. On behalf of the team here at the Community Sector Council, Newfoundland and Labrador, we wish you a great afternoon. We wish that you be well, and live well. Thank you, everybody.